Welcome to Module 6, where we go ahead and talk more about substance addiction. And this reason, the causes. So in Module 5, we went through the diagnosis of substance addiction and disorders according to the DSM-5, and now we're going to get a little bit more detail as to the causes behind it. And so a good way to kind of view the causes of substance addiction is using a developmental framework for really seeing how these come along here. So we're viewing the problems in terms of various stages. And the first one is the initiation and continuation. So you have to start using the substance and then continuing to use it. Probably being exposed to it either through things like your parents at an early age or going out with friends to social opportunities like parties. Then you're going to see an escalation and a transition to abuse. A lot of times this escalation is drinking more often or using the substance more often, maybe even starting to use it by yourself with no one else around. And that's kind of a key when people start using substances beyond a social aspect. When they start using solitary use, that can point the finger at more addictive type behavior. Then the development of tolerance and withdrawal. So, of course, this developmental framework can happen fairly quickly for the heavier types of drugs, things like cocaine or opiates. Those are going to go fairly quickly. For things like alcohol or marijuana, you probably are going to see a slower developmental framework kind of occur over time. And the importance there is looking at the level of tolerance and withdrawal. When you're not on that substance, the more severe of those, usually the higher signs of the substance dependency. Of course, what causes this is not an easy question to answer, and it's truly an integration of the next three factors that we're going to talk about, which is your biological influences, your social, and your psychological influences. So we're going to kick things off first by talking about the social factors. And one of the things is the manner of consumption. So in Module 5, we talked about the how culture plays a major role in the type of substance use that we use. And so anytime that you look at the causes behind substance use disorder, we got to look at the culture behind it. So there could be cultural or religious customs. Especially hallucinogens have played a major role in religion and religious ceremonies. And so alcohol is kind of embedded in even some of those activities. And then we look at other sorts of issues that culture kind of brings up. Another factor is your parental monitoring and modeling. So initial experimentation with drugs is much more likely to occur among individuals who are rebellious and extroverted, and also whose parents or peers model and encourage usage. So it is taking a risk, right? We've been told about the dangers of drugs since we were little, and yet somebody needs to overcome that and also to use. And so there is a rebellious aspect about using substances because most are illegal to use under the age of 21 or at least 18. And so you got to rebel against what society says is appropriate. And you also usually have to be extroverted and a little more outgoing. And then, of course, if everybody normalizes drug use, if everybody you know, your friends, your family uses it, then you're much more likely to experiment that. Now, parents modeling, so parents aren't immune. They certainly do use drugs too. And if parents are using in front of their children, then children are going to model those types of behaviors like they do in many other ways. It's also going to help when you see parents modeling their own usage. It's going to promote attitudes and expectations regarding benefits of drug consumption as opposed to negative consequences. And it may even provide access to illicit drugs from the more mild tobacco and alcohol, which is freely available and legal for those above the age of 18 or 21, to more illicit drugs like something like cocaine. Parental monitoring and discipline, this is where if parents are high on their monitoring, it's associated with actually a reduced risk of tobacco and alcohol. they estimate that it's going to delay usage by at least a few years. And as we talked about on Module 5, the influence of possible addiction is quite high the earlier you start. So every year you can delay an adolescent from starting to use or experiment with substances, the better off they're going to make them in resisting eventual addiction. It doesn't mean that you can't get addicted if you start with something when you're 21 or 25, but it does decrease the odds that you may become as addicted as quickly, and maybe you can use them in a more moderate to low manner and not have issues. Now, of course, the flip side has also been had. There are stories told about the cool parent who allows their children to have and drink alcohol when they're in high school as much as they want and in like their basement, but they're trying to be, quote, responsible by not allowing them to drive home. Of course, that's a very irresponsible way when we're talking about parents modeling and then, of course, a lack of monitoring and discipline in regards to usage. And then finally is your peer and sibling substance use. What we see here is that if you have peers or siblings that use, you are much more likely to use yourself. And that's the social aspect, right? You want to fit in. If your friends are doing something, then you want to do it too. And there's an enormous amount of pressure to fit in at this particular age. So that's the type of social factors that we're looking at. Biologically, there is genetics regarding alcoholism, and that goes for other addictive type or substance use behaviors. Patterns of alcohol consumption, social and psychological problems, all of those are related to alcohol. That often runs in families. If you are a family that tends to have some of these issues, you have a 3 to 5 time higher rate than in the general population of developing alcoholism yourself. Which is why, very important, if you see alcoholism running in your family, you need to try to just avoid drinking altogether, because you are probably not going to be one of those people that can just have one every once in a while. As you can see, the twin studies show both genetic and environmental factors are going to influence how much you drink and how often. So we already talked about some of the social factors, and then of course you've got the genes that make you more susceptible to this particular disorder. Now, you can see there are reward pathways, which we talked about previously in regards to dopamine. And this is where people can become more dependent on psychoactive drugs because they do stimulate that kind of reward pathway. And that reward pathway feels really good. That's why they call it the reward pathway, which means that it's very difficult to resist. And you want to feel more of that as you go on. So you can go ahead and see that. Next couple slides. First is just a basic reminder of the neurochemical mechanisms of drug interaction. And what you're looking for are those arrows there. And it shows the impulse being sent. And then the real key is in that lower portion of the picture there, where you see all those little dots going back and forth. That's called the synaptic cleft. And the synaptic cleft is where all the neurotransmitters go back and forth. So throughout these modules, when we talk about drug effects, we've been talking about neurotransmitters, and that's what the neurotransmitters are. They're the chemical communication portion of our nervous system. So you have your long neurons that are electric driven, and then once they get to the clefts, then they're chemical. And of course, these work very, very quickly, and the drugs usually mask one of the neurotransmitters and usually flood the synaptic cleft with an overabundance of a particular neurotransmitter, meaning that you have higher reactivity and thus leading to some of those reward pathways. And speaking of the reward pathway, you can see these are some of the areas that are going to be involved. You have the wonderful amygdala, which is your emotional center, the prefrontal cortex, the ventral tegmental area, and nucleus accumbens. And all of those are kind of a reward pathway for when you start using. So what we're going to talk about next is psychological factors that go into the causes of substance use disorders. And one of the big things are the expectations that come along with the use of a particular substance. And so they've done some studies and looked at people who have expectations of how are they going to feel after they have a few beers or some alcohol. And these are some of the common responses. It's going to transform any experience that you're currently in a more positive way. It's going to enhance your social and physical pleasure because some of your worries are going to go away, some of your misapprehensions. It can enhance sexual performance and experience. It can increase your power and aggression, increase your social assertiveness, and reduce tension. Well, as you might imagine, look at that. That looks like a wonderful list. If I saw that there was that list and didn't think about any implications of continued usage, this looks very favorable to me. And the more of these positive expectations you have, not surprising, is going to predict your drinking behaviors. Now, some of us may not say that all of this is going to happen because we know, for example, enhancing sexual performance is not really true, especially for men, because it can cause impotency and a lack of performance. But that's more from longer term usage. So the less you have, the more of this you have, the more you're going to probably drink. Now, the expectations are going to be influenced by a lot of environmental factors that we don't really have time to go through. We talked a little bit about parent and peer kind of attitudes, but you also have the portrayal of alcohol in mass media. Just look at all the shows that you watch, and people go out, and especially younger people, they go to parties, they're having good times. And that whole aspect kind of permeates into the expectations individuals will have when they start engaging in those behaviors themselves. So, those are the three main areas here of causes in regards to um, substance use disorders. You can see there they have the exposure to drug. So you have social and cultural expectations. So there's that drug use there. That's the social influences. Your psychological influences and positive and negative reinforcements, either escaping from particular feelings like depression and anxiety, or having positive things like increasing social interaction and feeling that you fit in. Then you also have the biological influences on how sensitive you are to the drug and how quickly you can metabolize it. You can't metabolize it very quickly. You will probably have that better feeling for longer periods of time. And then there's other things like your base level arousal and other mood or anxiety disorders that may go towards a higher likelihood of drug use, dependency, and eventual abuse. So that is the end of Module 6. In Module 7, we're going to talk about what do we do when you do become dependent on substances and go into more detail about treatment.